Welcome back to Flow State. Today we're diving into medical English, real-life conversations for seeing a doctor, picking up medicine, visiting the dentist, and handling emergencies. If you enjoy this immersive learning experience, please subscribe to support us. I need to schedule a doctor's appointment. I'd like to see a doctor as soon as possible. I would like to see a doctor as soon as possible. What time works best for you? What time works best for you? What time works best for you? I've been having this cough for a week. I have been having this cough for a week. Do you take my insurance? Do you take my insurance? I'm feeling dizzy and lightheaded. I am feeling dizzy and lightheaded. I've got a sharp pain in my lower back. I have got a sharp pain in my lower back. It hurts when I swallow. It hurts when I swallow. My throat is so sore I can barely talk. My throat is so sore I can barely talk. I'm running a fever and I've got the chills. I am running a fever and I have got the chills. The doctor's going to check your blood pressure. The doctor is going to check your blood pressure. Breathe in deeply and hold it. Breathe in deeply and hold it. Breathe in deeply and hold it. I am going to need to draw some blood for tests. Does it hurt when I press here? Does it hurt when I press here? We'll get the results back in a couple days. We will get the results back in a couple days. Quick tip when you say gonna or gotta, let your tongue relax. It's not going to fully pronounced. Just one smooth glide. Gonna, gotta. You might feel a little pinch from the needle. You might feel a little pinch from the needle. I'll write you a prescription for antibiotics. I will write you a prescription for antibiotics. You gotta take these twice a day with food. You have got to take these twice a day with food. This is a generic version. It's way cheaper. This is a generic version. It is way cheaper. Make sure you finish the whole course of meds. Make sure you finish the whole course of meds. I'm allergic to penicillin. Can I get something else? I am allergic to penicillin. Can I get something else? You should start feeling better in about 3 days. You should start feeling better in about 3 days. If the rash gets worse, call the office right away. If the rash gets worse, call the office right away. Don't skip any doses, even if you feel fine. Do not skip any doses even if you feel fine. Keep it in a cool, dry place away from sunlight. Keep it in a cool, dry place away from sunlight. You can pick this up at the pharmacy downstairs. You can pick this up at the pharmacy downstairs. I recommend an over-the-counter pain reliever. I recommend an over-the-counter pain reliever. This will knock out the infection pretty fast. This will knock out the infection pretty fast. Gotta shake the bottle well before using you. Have got to shake the bottle well before using. Call me if you have any side effects. Call me if you have any side effects. Quick tip in casual speech. Over the counter often sounds like over the counter without the hyphens. Just say it smoothly, over the counter meds. I'm here to pick up a prescription for John Smith. I am here to pick up a prescription for John Smith. The pharmacist said it'll be ready in 20 minutes. The pharmacist said it will be ready in 20 minutes. Could you double check if it's covered by my plan? Could you double check if it is covered by my plan? I need a refill on my blood pressure meds. I need a refill on my blood pressure meds. Do I take this with food or on an empty stomach? Do I take this with food or on an empty stomach? The label says take 1 tablet every 6 hours. The label says take 1 tablet every 6 hours. Is there a generic for this? It's kind of pricey. Is there a generic for this? It is kind of pricey. Keep it out of reach of children. Keep it out of reach of children. I totally forgot to bring my insurance card. I totally forgot to bring my insurance card. Can I pay cash and get reimbursed later? Can I pay cash and get reimbursed later? This ointment is for external use only. This ointment is for external use only. Let me check the prescription drop-off box. Let me check the prescription drop-off box. You gotta take the whole tablet. Don't cut it in half. You have got to take the whole tablet. Do not cut it in half. I also need some bandages and antiseptic cream. I also need some bandages and antiseptic cream. Sign here on the electronic pad, please. Sign here on the electronic pad, please. Quick tip, kinda is a relaxed blend of kind of. Drop the D sound a little, and it feels much more natural, kinda, sorta. Lotta Fay, you'll hear them all the time. I've got a toothache that's killing me. I have got a toothache that is killing me. I think I chipped a tooth biting down on something. I think I chipped a tooth biting. When did the pain start? When did the pain start? I need to schedule a dental cleaning. I need to schedule a dental cleaning. You're going to feel a little pressure, not pain. You are going to feel a little pressure, not pain. I'm just going to numb the area first. I am just going to numb the area. First, open wide for me. Let's take a look. Open wide for me. Let us take a look. You might have a cavity that needs filling. You might have a cavity that needs filling. The gums are a bit swollen and red. The gums are a bit swollen and red. Tree to floss more gently. You're going too hard. Try to floss more gently. You are going too hard. We're going to do a full set of x-rays today. We are going to do a full set of x-rays today. You'll feel a bit of vibration from the drill. You will feel a bit of vibration from the drill. Rinse and spit into the little sink. Rinse and spit into the little sink. I hate the sound of the drill. It freaks me out. I hate the sound of the drill. It freaks me out. Avoid very hot or cold drinks for a day. Avoid very hot or cold drinks for a day. Quick tip. Freak out is super common for feeling scared or anxious. You can say, I'm freaking out, or don't freak out. Keep the freak short and punchy. I think I need to go to the ER right now. I think I need to go to the ER right now. My husband cut his hand badly. There's a lot of blood. My husband cut his hand badly. There is a lot of blood. He's having trouble breathing and his chest is tight. He is having trouble breathing and his chest is tight. Can you send an ambulance to 42 Elm Street? Can you send an ambulance to 42 Elm Street? I feel like I'm gonna pass out. I feel like I am going to pass out. He hit his head on the pavement. He's confused. He hit his head on the pavement. He is confused. Stay with me. Do not go to sleep. Are you allergic to any medications? Are you allergic to any medications? On a scale of 1 to 10, how bad is the pain? On a scale of 1 to 10, how bad is the pain? We're going to run a CT scan to rule out bleeding. We are going to run a CT scan to rule out bleeding. The wound needs stitches, but it's not life-threatening. The wound needs stitches, but it is not life-threatening. Keep pressure on it with this gauze. Keep pressure on it with this gauze. I tripped and twisted my ankle really bad. I tripped and twisted my ankle really bad. Can you check his pupils? They look unequal. Can you check his pupils? They look unequal. I'm so dizzy I can't stand up straight. I am so dizzy. I can not stand up straight. Quick tip, air is just the letters E and R, but when you say it fast, it sounds like E, our practice. I'm heading to the ER. Me child has a fever of 104. I'm freaking out. My child has a fever of 104. I am freaking out. We've been waiting in the ER for 3 hours. We have been waiting in the ER for 3 hours. They're going to admit him overnight for observation. They are going to admit him overnight for observation. Do you have any nausea or vomiting? Do you have any nausea or vomiting? I'm going to give you something to ease the pain. I am going to give you something to ease the pain. Follow the light with your eyes. Don't move your head. Follow the light with your eyes. Do not move your head. You're going into shock. Keep warm. You are going into shock. Keep warm. The doctor will be with you shortly. Try to stay calm. The doctor will be with you shortly. Try to stay calm. She fell off the swing and landed on her arm. She fell off the swing and landed on her arm. I've got this sharp stabbing pain in my side. I have got this sharp stabbing pain in my side. We need to do an EKG to check your heart. We need to do an EKG to check your heart. Just a little poke for the IV. You'll be fine. Just a little poke for the IV. You call your primary care doctor for a follow-up. Call your primary care doctor for a follow-up. Cooled. You grab my wallet. It's in my jacket. Could you grab my wallet? It is in my jacket. The nurse will take your vitals now. The nurse will take your vitals. Now, quick tip, the phrase take vitals means checking blood pressure, pulse, temperature. It rolls off the tongue fast. Take your vitals. I need a referral to a specialist for my knee. I need a referral to a specialist for my knee. It clicks every time I bend it, kinda weird. It clicks every time I bend it, kind of weird. How long do I have to wear this cast? How long do I have to wear this cast? The swelling has gone down a lot since yesterday. The swelling has gone down a lot since yesterday. I want to wean off these painkillers slowly. Let's schedule a physical therapy session. Let us schedule a physical therapy session to keep the wound dry when you shower. Try to keep the wound dry when you shower. I'm gonna need a sick note for my boss. I am going to need a sick note for my boss. The stitches will dissolve on their own. The stitches will dissolve on their own air. These antibiotics supposed to make me drowsy. Are these antibiotics supposed to make me drowsy? I'll swing by the pharmacy later tonight. I will swing by the pharmacy later tonight. They've got a drive-through pharmacy window. They have got a drive-through pharmacy window. Can I get an inhaler refill? Mine's empty. Can I get an inhaler refill? Mine is empty. The label says may cause drowsiness, so no driving. The label says may cause drowsiness, so no driving. I'm super achy from the flu shot yesterday. I am super achy from the flu shot yesterday. Quick tip, swing by means to stop by quickly. In medical chats, you'll hear swing by the clinic or swing by the pharmacy. Super casual and friendly. She's got an ear infection and won't stop crying. She has got an ear infection and will not stop crying. The pediatrician said to use these eardrops for a week. The pediatrician said to use these eardrops for a week. Can you look into my ear with that little light? Can you look into my ear with that little light? I've got this ringing in my ears. It's so annoying. I have got this ringing in my ears. It is so annoying. My eye is all red and goopy in the My eye is all red and goopy in the morning. The optometrist said I've got an eye infection. The optometrist said I have got an eye infection. Put these drops in 4 times a day. Don't touch the tip. Put these drops in 4 times a day. Do not touch the tip. I think I got something in my eye. It's scratching. I think I got something in my eye. It is scratching. Can you please check my vision with the chart? Can you please check my vision with the chart? I'm going to have to dilate your pupils for the exam. I am going to have to dilate your pupils for the exam eye. Contacts are killing me, got to take them out. My contacts are killing me, I have got to take them out. I need a new glasses prescription, mine's outdated. I need a new glasses prescription, mine is outdated. Tree. Not to rub your eyes. You'll make it worse. Try not to rub your eyes. You will make it worse. I've been having these migraines every other day. I have been having these migraines every other day. The doctor wants me to keep a headache diary. The doctor wants me to keep a headache diary. Quick tip, gotta is the squeezed form of got to. So I gotta take them out becomes I have got to take them out in slow speech. Don't forget the have. I'm feeling a lot of pressure in my sinuses. I am feeling a lot of pressure in my sinuses. She prescribed a nasal spray and it works wonders. She prescribed a nasal spray and it works wonders. I've been sneezing nonstop. Is it allergies? I have been sneezing nonstop. Is it allergies? Maybe I need an allergy test to figure out triggers. Maybe I need an allergy test to figure out triggers. I can't sleep because of this hacking cough. I cannot sleep because of this hacking cough. The doc said it's bronchitis and gave me an inhaler. The doc said it is bronchitis and gave me an inhaler. Make sure to drink plenty of fluids like water and tea. Make sure to drink plenty of fluids like water and tea. Me lymph nodes are swollen. I'm kind of worried. My lymph nodes are swollen. I am kind of worried. The urgent care clinic is faster than the ER. The urgent care clinic is faster than the ER. I just need a quick strep test. That's all. I just need a quick strep test. That is all. She said my blood pressure is a bit high today. She said my blood pressure is a bit high. Today I gotta cut down on salt. Got it. I have got to cut down on salt. Got it. You have to fast for 12 hours before the blood work. You have to fast for 12 hours before the blood work. I fainted this morning and hit my head on the sink. I fainted this morning and hit my head on the sink. They're going to do an MRI to see if there's any damage. They are going to do an MRI to see if there is any damage. Quick tip, MRI is just letters FE, MRI. Same for CT scan, EKG. Don't spell them out slowly in fast speech. Just say I naturally. The tech said to lie really still during the scan. The tech said to lie really still during the scan. I'm claustrophobic. Can I get something to calm me down? I am claustrophobic. Can I get something to calm me down? I need a referral to see a dermatologist for this rash. I need a referral to see a dermatologist for this rash. It's been itching like crazy. I can't stop scratching. It has been itching like crazy. I cannot stop scratching. Apply this cream thinly twice a day after washing. Apply this cream thinly twice a day after washing. Do I need to come back for a follow-up? Do I need to come back for a follow-up? The pharmacy said my insurance doesn't cover this brand. The pharmacy said my insurance does not cover this brand. I'll pay out of pocket. How much is it? I will. Pay out of pocket. How much is it? Can you explain the side effects in plain English? Can you explain the side effects in plain English? I'm supposed to take this on an empty stomach, right? I am supposed to take this on an empty stomach, right? The pharmacist gave me a pill splitter for the big tablets. The pharmacist gave me a pill splitter for the big tablets. I always forget if I took my morning dose. I always forget if I took my morning dose. Set a reminder on your phone. It helps a ton. Set a reminder on your phone. It helps a ton. I'm finally done with the antibiotics, feeling way better. I am finally done with the antibiotics, feeling. Thanks for taking care of me, Doc. I really appreciate it. Thanks for taking care of me, Doc. I really appreciate it. Quick tip. When you say thanks for taking care of me, Doc, the word doc is a warm, casual way to address a doctor. Use it to sound friendly and appreciative. Thank you for spending your time with me. If this episode helped you feel more confident, please like and subscribe to the channel. Stay in the flow, and I'll see you in the next episode.